Good afternoon. My name's Ben Anderson. I'm the Director of Maternal Child Health Initiatives here at Families USA. We'll be getting started in a couple minutes. If folks will just sit tight, we'll start soon.
First of all, just thinking back to like hospital pricing, how did that, were there discussions?
You spend $10,000 a year in between homeowners and car insurance.
Okay. Thank you, everyone. We'll go ahead and get started. Again, my name is Ben Anderson. I'm the Director of Maternal and Child Health Initiatives here at Families USA. And I want to thank you for joining us and welcome you to an exciting discussion that we'll be having today about how to create a doula benefit in Medicaid. So before we get into that, I do want to do just a bit of housekeeping first, if we can go to the next slide. So there will be an audience Q&A portion of the discussion today. If you have questions, the best way to submit questions is through the Q&A feature in Zoom, which you can see highlighted on the right. You can also send us messages through the chat box feature, but we won't be taking any live questions today. So to be sure to submit everything through Q&A. Finally, we'll plan to wrap everything up around 1 o'clock. We've blocked a little extra time on your calendars in case we go over. But we won't be keeping you beyond 1:15. So I want to take the time to on the next slide, just make a couple other announcements about our maternal health work here at Families USA. First, our Health Equity Academy for the upcoming 2023 and 2024 cycle will focus on maternal child health. The application is going live later this month. So if you're interested, or if you know someone who may be interested in applying, please reach out to Chelsea Dade here at Families to make sure you get the application. Second, next week, we'll be publishing a new report on how to leverage Medicaid to improve maternal health. We'll be covering several different maternal health interventions, including doula care, midwifery, and group prenatal care. So if that's something of interest to you, please keep an eye out for that. And finally, if you're working on maternal health at the state level, we want to hear from you. We're most interested in learning about what you're interested in and what tools you need. Is it communication support, coalition building guidance, policy research, data analysis? We know there's a lot we can be doing to help advance this work in the states. So please reach out to us and let us know what you need. And again, Chelsea is your contact there. So next, we'll begin our discussion with our panelists. We'll be having a conversation over the next 40 minutes. And then we'll have some time for audience Q&A. So without further ado, let's get started. So if we could, I'd like to invite mom and maternal health advocate, Juanita Street, to join me on the screen. I'll wait while get folks pulled up here. So Juanita is a new mom to a beautiful 3-month-old baby boy who is her world. Juanita is passionate about sharing her childbirth experience with others to help empower other families so they know they have choices and options when it comes to how they give birth. So if we could, I'd love to welcome Juanita.
Hello, everyone. I'm grateful to be here and able to share my story.
Great. Thank you so much, Juanita. So Juanita, when I think about doula care, the first thing I think about is how our nation is in a maternal health crisis. Black women are are 3 times more likely than white women to die from pregnancy or childbirth. And then I think about all the amazing outcomes that we see in people who are able to use a doula. We see longer gestations, lower C-section rates, fewer complications, and so many more things. And I know from speaking with you before that you wanted a doula to be part of your pregnancy and birthing experience. Can you tell us more about that? Why did you want a doula and how did it work?
Right, exactly. So I knew that going into, first of all, I had a difficult time getting pregnant. I had PCOS, and it took us about 6 years, and then I finally got pregnant. And going into it, I had heard stories. I knew of family members who didn't have very good experiences with childbirth. So I had sort of like an imminent fear going into it. And I knew for me, I'm the type of person that I just wanted to be as educated as possible about what my options were. I had spoken with friends about doulas before, or having access to a doula before. And one of my best friends actually had sent me information on Birth in Color RVA to apply to have a doula. And so I made sure that I did my research and I kind of knew what I was getting. I kind of knew what I was getting into, but I still wasn't 100% sure. But this was my access to kind of figure out if this was a good fit for me or not. And so I did the application process, and I did an intake with Birth in Color RVA, and I was matched with my doula within 2 days. And we did the intake process. She gave me a whole breakdown of what the expectations were with working with the doula, and what my expectations were, what I wanted from my childbirth experience. We talked about my anxieties. We talked about the things that I was fearful of. And she was really with me every step of the way through the entire process of my pregnancy. And honestly, I really didn't know what I was going to get going into it. And the whole entire experience became a beautiful experience because I had a doula. And I remember we did the intake process. We had home visits. We had follow-up checkups. After almost every single visit I had to my OBGYN, there was a follow-up check-in to see how everything was going. Did I have any concerns? What stage was I in with the development of my baby, and we really built a deeper rapport throughout that entire process. And so when my child decided he wanted to come a little bit early, the anxieties flew around again, and my doula was there with me every step of the way. My son was actually born about a little over a month early. I was hospitalized. My water broke early. I was hospitalized for up to 21 days and for 21 days. And my doula was with me the entire step of the way. She checked on me in the hospital every single day. And even when I was like having all this anxiety and all this fear, because, you know, going through something like that, you don't know what's going to happen. You don't know what to expect, you know, even though you're entrusting in your healthcare providers and your doctor, your OBGYN to tell you all the ins and outs. It was wonderful to have somebody there that was checking in and saying, this is what to expect. This is what you should advocate for. This is maybe another question you need to ask them about that process. And that was actually my entire pregnancy. Every visit, it was like that. Advocate for asking additional questions, you know, make sure you talk about your background healthcare so that they're fully aware, you know, make the most of your opportunities while you're at your visits to express any concerns that you had. So in going into, you know, these 21 days in the hospital, I felt very much more empowered within my experience because I had built that rapport and because I had that person, that doula that was with me that said, you know, you can advocate for these things. You can say that you want to check your blood pressure, you know,
Well,
after you sit down.
let me
Yeah.
just to kind of break it down for our audience, because I think you've already told, I think, a lot of, you know, how a doula can really help set you up
Yeah.
to have the kind of birth experience that you want. And, you know, for folks in our audience who I know are interested in how to do this through Medicaid, just want to be sort of clear, you know, you dropped there in the beginning that, you know, you actually have private coverage. And so we had to access through a different avenue. But a lot of what you're saying, you know, I think the experience is common, you know, no matter where your coverage is coming from. And you noted, you know, you had this, you had access to a doula prenatally, right?
Mhm.
And then, you know, ran into some complications and ended up in the hospital. How did that shift things, or did things change, or what did that look like once you were in the hospital in terms of connecting with your doula, and what kinds of issues did you have to work out with providers while you were there?
So we had already developed a very strong birth plan. So I knew what my expectations were, whether we both knew what the expectations were, was what we wanted and what I wanted as far as my birth plan prior to even having this issue going into the hospital. So some of the things that I ran into was, you know, having to ask when is the goal was a possible C-section. When you go in early and you're there for 21 days and you rupture early, you know, the providers talk to you about the concerns about infection, concerns about the child's development. And in my birth plan, I did not want to have a C-section. It was very clear I did not want to have a C-section. And so my doula was there to assist me with advocating that particular thing, knowing that there was a high possibility that I was going to end up having a C-section anyways, but empowering me to know that I can ask certain questions. So I made it to 34 weeks, which I was grateful for. And when it came to that point, there was the question of, could I wait longer? And my doula empowered me to ask that question. We knew the possibility of that was probably low based on what our doctors and the providers were telling me, you know, the entire time I was there. Get it to the 34 weeks, make it to the 34 weeks. And then we're going to induce. But in my mind, I was like, what was the risk factors that were if I waited a little bit longer. And I was empowered to ask that question. And then I made an informed decision, okay, based on what the collective has talked about and what I feel comfortable with, I felt good moving forward with the induction. I was induced. My child did not respond well to the medications that softened the cervix, and his heart rate dropped. And we stopped the medications. My doula was there with me and the nurse communicating about the process of induction, how much medication we were given every single time, you know, if I wanted to get an epidural or if I didn't want to get an epidural. And a part of my plan was already that to tell that she already spoke with the nurses and they had on plan already was to not ask me if I wanted an epidural, because I did not want to be prompted every single time. Do you want it? You're in a lot of pain. Do you want it? I wanted to, even though that my experience was possibly going to lead to a C-section, I wanted to be empowered to know that I was going to do everything that I could to have a natural childbirth. And so that meant me not getting an epidural. For me, I didn't want that experience. And I went 10 hours with consistently increasing the induction medication with no progress. My baby's head was still at the top. He was not coming down. And every single time the OBGYN came in to check, I was not even past the centimeter dilated. So then it became pain over, you know, safety of my child, over, you know, what's the next steps, you know, what's the best scenario right now. And I had a lot of one-on-one conversations with my doula and my family present there that allowed me to make the best informed decision for me. I felt comfortable knowing, okay, I'm in a lot of pain right now. I didn't want to explore having an epidural, but now I might be at that point, right? So, you know, what's that next step? So I ended up getting the epidural. I still made absolutely no progress hours later, but just know the doctor came, the OBGYN, every time he came in, there was, you know, this baby's not coming the way you want it to come. You know, this baby's not coming the way you're expecting this baby to come. You're probably going to have a C-section. And I felt confident enough to say, I'm willing to wait and see. I'm willing to wait and let my body progress, you know, and to see what's going to happen. And after about 12 hours, the 13th hour, I felt comfortable enough and empowered to say, okay, yeah, this baby's not coming. Because my doula told me, we talked about the position of the baby's head. We talked about the negative and the positive of where, you know, your baby is positioned, what the expectations are if you got to this point, you know, close to this time frame. And, you know, you have to feel comfortable about your choice. And I opted to inevitably get a C-section. And my baby came out safe and happy. And, you know, he was in the NICU for about a week. But even after that point as well, my doula was there every single step as well. So you're talking from intake to all of the appointments with my OBGYN to participating in my actual childbirth. That was 12 hours plus of childbirth. And then throughout when my child was in the NICU for a week, doing check-ins, follow-ups. And then afterwards, having postnatal home visits as well. So during that time period of being in the hospital 21 days, not working, I did not qualify for maternal leave. So I was not getting paid. So there was a lot of case management style support as well for me from my doula, connecting to resources, connecting to, you know, possible opportunities for access to different resources and items that my child might need. And then also, in knowing of my age, I'm 35, the higher susceptibility that I had to postpartum depression after having my child, you know, there was a lot of proactive communication about access to a counselor or therapist, and, you know, connected me to those supports. And somebody, you know, coming from the case management background, coming from a mental health background, I was a huge proponent of that from the beginning. So I wanted to proactively, you know, be engaged with that anyways, just to make sure that I was covering my own mental health afterwards. And so she connected me to a provider, actually, who I have been seeing every 2 weeks, and support for postpartum after my child's birth, for support with, you know, my child being in the NICU, going through relationship changes, going through becoming a brand new mom, you know,
Yeah.
going
Yeah.
through
Right.
having the funds to pay for certain things that I thought I would have access to during this time, this supposed to be beautiful time in my life. And, you know, it became more so of not just a relationship to just support my pregnancy, but it was a rapport building to know that I had an additional person that was there that, you know, had all this wealth of information that I had instant access to if I needed. That was the most beautiful experience that I've ever had. So
That's such a beautiful story. And we see, I think your beautiful baby boy
yeah,
up over your shoulder back there. So happy that he's healthy and doing well. I also know from talking with you before, you know, being on bed rest wasn't easy,
yeah.
and your doula sort of helped you navigate that. Can you share more about that?
Yeah, so I have past trauma from being in hospitals, and my mom being sick and in the hospital. So it was very triggering for me to be in the hospital on bed rest and not being able to move or go anywhere. And my doula was actually the person that said, you know, you can ask your doctor if you can get up and walk around, right? And I was like, well, I'm on bed rest. I wasn't challenging her, but I'm like, I'm on like mandatory bed rest. She said, well, you can ask. And, you know, in certain circumstances, they will allow you to go for a nice walk. And when I was just like, wow, I didn't know that I could ask. I can walk around. And my doctor gave me the green light. But in my mind, I went, why was that not given to me as a possible option from the beginning? There was no communication of, you know, you can get up and walk around. It was like, you're on immediate bed rest. You have to, for the foreseeable future, until this baby gets here, you must stay in this bed. And it didn't cross my mind that I had an opportunity or option to walk around, because the thing that was ruminating in my brain was, I have to keep this baby safe. I have to follow everything what the doctors are telling me, or, you know, I have to do everything and I'm grateful that I had not somebody that challenged the experience, but somebody that offered the alternative to the mindset, right? Because me getting out and going for walks was necessary for my mental health. And I truly believe that it was something that I needed in order for me to get through that process mentally, because staying in that room was very draining for me. And I had to be in the best mindset that I could be in so that I could have a positive birth experience, and so that my child could, for what I felt like could be as healthy as possible. I needed to be as healthy as possible. And then it was things like, you know, you can bring food from the outside if you want to, you know, you
Right,
don't
right.
food that they have here. I'm like, oh, I didn't know I could bring other alternative food. It was, you know, you don't have to wear the hospital gowns. You can bring your own outside gowns with, you know, outside clothing with you. And I ended up, you know, bringing in like my regular house pajamas, because I literally became a resident of the hospital for 21 days while I was in
Right.
there. We talked about, you know, things that I could bring in that could bring me entertainment. We talked about words of affirmation. We talked about words of affirmation. And so I ended up writing out like affirming words that we put up on the board. And it was actually something like during childbirth, she brought cards that had affirmations on them that we put around the hospital room as well, that helped to affirm me, because that was something that was important to me. You know, words of affirmation was very a huge and powerful tool for me as well. She knew in our birth plan that, you know, I really, really liked calming smells and relaxing smells. So that was the option for me as well, which I didn't know you could do. I didn't know that you could bring, you know, lavender smells to the hospital to help calm you down during
Right.
childbirth. I had no idea. So these were things that, you see, and I hate to use the word stigma, but when people initially think about doulas, there's like this stigma around it that you're only having a child at home in a water birth with a midwife. And this experience completely shattered my notions and stigmas of what a doula was for me. And because of that, I now move forward and like try to empower other people that they have alternative options for what their childbirth experience can be that go beyond what people think a doula is or what they expect a doula to be. And I really lucked out. I got an amazing doula and I
That's
had a great experience with Birth in Color RVA.
that's fantastic, and it's such a I love your story. I think it's such it's clear that you had the experience. It may not have gone exactly the way that you wanted it, but you felt safe and secure in navigating this large healthcare system that it doesn't always treat people the best, right? Just to put it mildly. So I think you've given us sort of, a lot of great things to think about in terms of how a doula is important in this process. So I want to thank you so much for sharing your story with us, because it provides such a powerful and important picture. But I'd like you to stay with us for the remainder of the conversation, and we'll probably have some more questions for you. So I'd like to now invite Kenda Sutton L and Consuelo Staton to join me on the screen. We'll take a moment while they're getting pulled up. But for folks who don't know, Consuelo is currently the Virginia Resource Mothers Program and Doula Certification Coordinator for the Virginia Department of Health's Office of Family Health Services. Consuelo is the subject matter expert for the Virginia Department of Health on their doula initiative. And the Virginia Department of Health partners with the Virginia Department of Medical Assistance services to operate Virginia's Medicaid doula benefit. So just to be clear what that means, Virginia's kind of here on sort of like double duty. And we'll be sharing lots of our questions back to the Department of Medical Assistance. And so we may have to circle back with everyone depending on the questions that you all have today for the Commonwealth of Virginia. And then our other guest, Kenda Sutton L, is an activist focused on raising awareness and creating initiatives for Black maternal health in Virginia. She is the founding executive director of Birth in Color. And Birth in Color is a leading organization that focuses on the care of people of color and supporting doulas in the workforce. Kenda has worked with Vice President Kamala Harris on reproductive health issues and currently serves as the chair of the Virginia Doula Task Force. Are we able to get Kenda and Consuelo pinned on the screen? Okay. Well, while we work on that, I am going to go ahead and ask Kenda. Kenda, I see you're unmuted. So first of all, welcome. And you just heard Juanita's story, and she shared a lot of examples of what a doula does. For our audience who may still be learning, is there anything else you would like to share about how you define a doula and talk about your work?
Sure. Thank you so much for having me, and good afternoon, everyone. So Juanita's story was actually great, and this is the first time that I've heard her story. So I was like, oh, wow. I even looked up like, okay, let me see who her doula was, because she did have a Birth in Color doula, even though I've read the notes, but I wasn't connecting that this is Juanita. So I'm so glad that you had a great birth experience and that we could support you. And so really a doula is exactly what Juanita said, someone who's going to provide emotional, physical and just social support and helping to bridge a gap between the communication between the client, the provider, case management, different resources. Because a lot of times what we do realize is that sometimes people don't know where to find resources. They don't know what questions to really ask because we don't really talk about birth and what the pregnancy should look like. We always talk about it from a clinical perspective, but not from like a regular person who's actually having a baby. So when you think about how much stuff gets missed in that translation and people not really understanding what a provider is even saying to them. And sometimes providers will explain things, but not really explain it to the terms where someone actually feels comfortable to ask additional questions because they don't understand what they're actually happening. So that's where doulas actually come in. And just like she said, like she didn't know that she thought she was on bed rest and couldn't move, couldn't do anything. But the doula just saying, like, just ask the question. Ask your provider, can you actually get up? And like clinical and providers would think like, that was so simple. She could have just asked that. But she didn't feel comfortable enough to ask that question. And so when we think about it from that perspective, it's like, okay, had she not had a doula, she would have just sat there in the bed and not having any great blood flow circulation. It could have caused other risk. And so just being able to get up and have a peace of mind and just walk around, go get some fresh air could actually change the state of her mental health as well. And so when we talk about maternal health, we have to talk about maternal mental health. And so a doula can actually help cover all of that, or either bring in additional resources and do that case navigation to where they're having other people they can actually talk to.
Such a great point. I'm thrilled you're making all of these connections, you know, in terms of resources and that relationship with the provider. I want to ask Consuelo, from the state perspective, when it comes to state certification in Virginia, what is it that you look at for or require in terms of, what a doula is and what are the kinds of things that they're doing?
Mm-hmm. And hello, everyone. Can you hear me?
Yes.
Okay, hello. And thank you for this opportunity. And Juanita, you are a superstar. I'm just loving your story and knowing that we were part of this, this process for you. With the Virginia Department of Health and with DMAS, which is our Virginia Medical Services, Medical Assistance Services, we pulled together a joint process for the state doula certification and how that will move into the Medicaid doula provider process. It went all the way back to 2019 when the both agencies went out for listening sessions across the state, and the doula cry was out there for us to start looking at Medicaid benefit possibilities for doulas. And both our agencies went to the General Assembly with proposals to put together a process. So the Virginia Department of Health moved into the state certification process, and then DMAS pulled their stakeholders to pull together the information for the benefits. So we both were initiated to do this process. We thought we were going to do it in, in tangent, and it just ended up being a great experience. So with that, both of our agencies put together a stakeholder work groups. I put together the work group that encompasses the doulas, midwives, OBGYNs, a cross-section of people that will pull together to start with the actual requirements for doula certification. And then DMAS started looking with the MCOs and also doulas and other stakeholders to start putting together the rate plan and the process of how doulas can be connected to the DMAS process. So with the doulas, we worked with, my great friend who's also on this call, Kenda, and other birth collectives, which was Urban Baby Beginnings and Motherhood Collective, to pull together the requirements to really define what a doula will be for state certification. We moved in putting together an MOA for a certification board. So the Doula Certification Board is our certifying body that reviews all of the doula applications and approves them to move through the process for the doula certification. Now, we invited all doulas to come to be part of this, but it was their option to move into the doula Medicaid provider process. There were some, because there were doulas who were already certified and they've done their job and they were doing their work in their communities, we didn't want to create a barrier for them to not be involved in the doula process. So what we did was to look at the doula training certification people across nationwide and locally, and put together an abbreviated approved list of doula trainers to ensure that they could submit their information. We can look at what they've already done and move them into the process. So at the beginning, we had 11 doula trainer approved list people. And then from there, we started the process. In January of 2022, we opened up the process for the state doula certification, and people moved in that regard. And also with the doulas who were approved, we started granting them information so they can go and become the Medicaid doula. And that was a process because, again, the MCOs were involved, the actuary insurance people were involved. They looked at the rates that would be amendable for people. We talked about how a member could be referred to a doula. We've talked about the stigma of doulas because sometimes hospitals and medical providers had different stereotypes about what doulas would do or not do. So it was part of an education process. And along with the DMAS staffing, Natasha Turner, who is the doula policy analyst, worked with me to make sure that those processes were in place. So DMAS has a comprehensive doula training, medical billing information. They have connections with the MCOs. And so that process really moved as smoothly as it can be, given that it was all a brand new initiative. We were really breaking ground on things that we just didn't know about. And we had wonderful allegiance with the community. They were involved every step of the way. We had a really good experience, and we will continue to move on in that regard.
No, that's such a, I think, wonderful description of sort of like the sort of the history of this process and this project over the last 4 years. And I think the part that I really want to highlight the most for folks who are thinking about doing this work in other states is what you guys did. But you brought everybody together, right? Like you weren't doing this work on your own, at the state without the input of doulas who know the work and know what they need. And I think that's an important lesson that we've seen. I think we all know that, Amy Chen and her amazing team at NHelp have been, facilitating similar conversations out in California and elsewhere. Kenda, what did this all look like for you? And I'm most interested in hearing, about the reimbursement part in Virginia, and how that conversation went and how that's working.
So for me, it went a little bit differently, only because I was in it from the very, very beginning. So prior to the listening sessions, we actually had we had our own panel discussions. And so we raised awareness in our state first to make sure that people understood what do doulas do, why are they so important, and to get on the governor's radar. And so then prior to that, after that, we went to legislators and was like, hey, this is what we actually want to do. And we don't want it to be framed the state way. We want it to be framed from doulas. So then it was like, okay, what do y'all want? And so we're like, we want a doula bill, we want a study bill, and then we also want a job that has Medicaid. And that's how Medicaid has the doula analyst position, because we wanted someone that could connect directly to the doulas so that it wouldn't be so hard to actually get a hold of someone at DMAS if there was an issue. And so when we did that, and we did the study bill, which engaged all of the different doulas from around the state to figure out, okay, what do y'all get paid? What do you normally charge? What is this like? How do we come up with perfect regulations? And that's when the chief, she's the director of Medicaid now, she actually came up to me and she was like, hey, we want to actually get in on this bill. We've wrote a plan. We think that it's great. And I said, only if you're going to truly let the doulas lead it. Like, we want to lead it. And she said, Kenda, trust me, I got you. We're going to do this together. And once she made that statement, everything we have done it together for the last 4 years. And I think that's what's missing in certain states, is that the state wants to have this recognition and leave out that, oh, the doulas are doing this. So let's actually engage them so that we can have the perfect bill. And so that's where we looked at. We gave some, it was a negotiations back and forth of like, okay, what does this look like? Can we do it this way? Let's look up regulations. Let's see if we can actually go around this. And so when it came up to the reimbursement, at that time, the reimbursement would have been the highest reimbursement for doulas across the United States. But then everyone started looking at the Virginia doula reimbursement bill. So now other people are getting higher, paid more. And so we're like, okay, well, now that we almost at the 3-year mark, we can actually go back and say like, hey, what about changing this policy? What about changing that? And let's go for a higher reimbursement. Now that we've tested it, we've seen clients are paired, Medicaid clients are actually paired with doulas. We're seeing the births, we're seeing the different outcomes, we're hearing different stories like Juanita's. And so now we're able to say, okay, this is actually working great. What about doing actually more? And it's been such a great collaboration just across the board in general, because we all are communicating with each other. We're watching it from the very first time that we actually put the first bill in, to everywhere we're going. And then even the medical billing part, we've tested it. We've been like, okay, let's figure out if there's any errors. We got to go back. We got to fix this system. And it has been like truly a phenomenal work just across the board in general. And then one of the things that I always like to highlight too, is that our study bill, I know a lot of people complain about the medical billing when it comes to Medicaid, but our bill actually has a 14-day policy. And I think people overlook that. And
tell us about that. Tell us what that means.
So that means from the time that we actually submit the bill, the doula has to be paid within 14 days. Or else they'll start to do, the interest fees and like different stuff like that. And a lot of people overlook that. And I always tell them, like, when you're studying Virginia's case study in the study bill, make sure you actually include that, because therefore we aren't experiencing that barrier of waiting to be paid for all of this time period. And that's where a lot of doulas from other states are having an issue, where some have billed a claim and still haven't been paid out from the claim a year. And so our DMAS and our VDH and all of the MCOs, we all decided that we're going to be collaborative and do this together. So therefore, if there is an issue with the billing, we're able to say, hey, get on the phone, like, hey, this is the code, this is what they're saying. Can you tell us what's hold up with the bill? And so then they're actually saying, oh, well, okay, you got to fix this. Oh, this was the error on our part. And we're doing that constant communication just to make sure that if you are individual doula and you are billing on your own, we don't want you to experience any type of barriers to it. Of course, most doulas want to be under organizations because it's seamless, but we want to make sure that the individual doulas, the legacy doulas, and all of them actually know exactly how to bill and everything that goes along with that as well.
Okay, so we've got a lot here. We've got a lot happening, right? So you did the study group, or you had the study bill. The group comes together to sort of unpack, what doula reimbursement should look like. And we know from Juanita's story that there are these, important stuff happening prenatally where you want the doula involved. There's, of course, labor and delivery. And then there's also important ways that a doula can help after labor and delivery. So are doulas in Virginia under Medicaid able to get paid, sort of during each of those phases?
Yes, they actually can bill every per visit if they want to, or they can bill it all at the same time, or they can bill the prenatal and the birth. They can bill it however they want to.
Mm-hmm.
Okay.
Yeah, a member is eligible for up to 9 visits, and it's the initial perinatal visit. It can be either live or virtual. It can be up to 3 additional perinatal visits, 4 postpartum visits, the attendance at the labor and delivery, and then any postpartum things. There are incentives for doulas who can encourage their client for their first 6-week medical doctor visit. And so there's a lot of things. And also for the doula, for the member, they just have to be eligible to receive the doula services. They have to be a Medicaid member and either currently pregnant or has given birth within 6 months, and also obtain their referral through a licensed provider. So those things are part of that whole process. And Kenda is wonderful in giving all that overview, and I'm so excited that she's doing that. And that we also want to say that we are the 4th state to receive the Medicaid eligibility for doulas. And you're so right, Kenda, that we were at one time on the top of the rates, but people have observed us and are upping us. And so we need to definitely come together and increase those rate studies.
Absolutely. And it's fantastic. And I think you have such a great story to share out, which is why we wanted to bring you all together today. And so we've talked about, you need to have, training and certification requirements in order to stand up, your Medicaid benefit. We've talked about issues around reimbursement and how bringing everybody together, including on the training side, can really help shape a good benefit that you'll be able to actually enroll doulas into if it's set up properly. And Kenda, you touched on it a little bit, but I think, Consuelo, feel free to jump in, or if you want to defer to Kenda, that's fine. Let's talk about billing a little bit. What kind of support do doulas get in terms of billing? Because that can be a whole, we're talking about, these issues around, in other spaces in maternal health when it comes to social drivers of health and CBOs delivering services. And that is hard for someone who doesn't have, to get into Medicaid and deal with a very sort of rigid system. How has Virginia been able to help you?
So it looks a lot differently for everybody, I would say. Because we have a big organization. So the Medicaid billing for us, we've recruited billers of I have some family members who are Medicaid billers. So it was okay, hey, I have questions, what does this look like? But also our managed care organizations have been really top tier. I can say that they have put in plans and hey, this is the a cheat sheet. Hey, Kenda, like, let me know what you're seeing on your end. Like, do you have any flaws? Like, they pushed me like, well, just build a fake claim, Kenda, because you're taking forever to build this. So can you just build a fake claim? Because we really want to make sure that it goes through the system seamlessly. If you have an issue, here's the person that you contact them immediately. They have been actually monitoring the doula billing to make sure, and I want to say that's what other states are missing too, is the collaboration with the managed care organizations. Our managed care organizations was at every implementation meeting, was coming to our doula task force meetings, like, hey, what communications plan do we want to make sure that our communication is what y'all want us to put together. And I want to say that's why ours were so powerful, and we haven't had a lot of those billing issues because we all collaboratively work together. So I don't have anything negative to say about our billing, because it's really truly been great. It's been amazing when it comes to the way that our managed care has been engaged this entire time. And our DMAS made sure, and our state made sure that they put doula benefit is the priority of the day. So if we put it, if we put in an application for somebody to become Medicaid certified, if that application haven't moved within 10 days, they're all calling like, hey, what's going on? Have she did her fingerprints? We're trying to figure out why she's not approved yet or what the issue is. And so it's been like that the entire time. And so I would say, like, to other states who are trying to do it, is make sure like you're engaging your managed care organizations from the very beginning, and you have lead contacts, because they're going to make sure that billing is easy. And even for the individuals, say you're not a part of Birth and Color, even for those individuals, we still have where DMAS, the doula analyst, is reaching out to them. The managed care organization, as soon as they see that they're enrolled in their doula, like, hey, which location are you in? We want to be able to refer clients to you. What does this look like? All of the things. So they're engaging them from that level also. So it's been like really like a twofold, like, okay, what's actually happening? And then some of them, we've did doula webinars and stuff like that. So some of them will either reach out to myself or reach out to one of the other organization leaders and say like, hey, Kenda, I'm having a problem with this. What does this look like? And now we're in the process of like, hey, do we actually want to think, we're weighing the hubs issue of like, hey, do we want to do a central billing where everybody's billing under one organization? What does that look like? What's the pros and the cons, and how to like make it seamless for those people who don't want to do administrative work. And so we want to give them that option too. So that's what we're currently looking at, which I think that our managed care organizations have been great with engaging with us, making sure that the billing is going like it needs to. I've had billing before and I've had a claim denied, and then I just sent it to the managed care organization, and they actually just reached out and was like, hey, let's figure out, can you follow up? Tell us what the deal is. And it was fixed quickly within, like, typically they have been responding within 24 to 48 hours.
Okay, great. Consuelo, anything to add there?
Well, as Kenda said, we definitely walk people through the process. We're not leaving anyone behind. If they have a question from the state certification level to the actual billing, no one gets a hold on their phone or their email. I think the response time is wonderful, and that anyone who has a question gets their question answered fairly quickly.
That's great. So just to sort of to kind of recap, sort of where we've been and things we've covered. Juanita shared sort of all the amazing things, all the amazing ways a doula can be there for you as a mom. We've talked about training and certification requirements, setting those up as part of the doula Medicaid benefit. We've talked about reimbursement, and then we've also talked about support for billing, which is key too. We're going to do some audience Q&A now, and I want to bring Juanita back into the conversation. So Juanita, when you were in labor, and at any point during the process, because you were there, we know you were in the hospital for quite some time, how did your doctors react to you working with a doula, and was there interaction between your doula and the doctors? And did that work well? What was that like?
I think that's a great question because I was actually thinking about that as we were talking more too, because I remember that was something that I did not speak to. And I was fortunate enough that I had a doula in Birth and Color who had built a rapport and were building a rapport with the doctors and the nurses at the hospital that I chose to have my child at. And so it was very normal. It was almost normal that the doula was there because they would go, oh, we would come across nurses and say, oh yeah, I worked with that doula. I worked with her before with another childbirth, or the doctor was very familiar with the doulas already being present, for other women who had children at their hospital. And so I felt like that the experience was very, it was natural. You did have some, nurses there that they were not as familiar maybe, but then you had other nurses that were there that were like, oh yeah, I've worked with her before, I'm excited that she's coming back with you and I'm ready to work with her. And then I actually had 3 nurses throughout the childbirth part of my experience because there were shift changes, so that's a thing as well. And the initial nurse that I worked with was very, very communicative with my doula. Any questions that were asked, she directed towards the both of us, and she allowed opportunities for like clear communication, and she was very clear about what she was doing next, about increasing induction medication. She was very open to discuss any questions that I had, and I truly believe it was because I had a doula there. If I did not have a doula there, I really feel like it would have been more of like, this is what's happening. Okay, let's move to the next person. You never know, but that's how I felt. I felt like because I had a doula present, there was more opportunity to give more clarification about what was going on throughout my childbirth. And I also truly believe that, when it came to me wanting to wait it out just a little bit longer, I feel like if I did not have my doula there, it would have been like, let's get this baby out. Come on,
Right.
let's get this baby out. And I think because my doula was present, it allowed the opportunity for that communication and for that opportunity for myself to have that time to weigh it out. So I guess overall, I saw the rapport that was already present there with the doulas in the hospital. I saw the rapport that was being built. My doula in particular, she would stop by through the nurse's desk and she would talk with the nurses there as well. And she would, she would make sure that she said, I'm going to be here around this time. I'm working with this person. Any nurse that I came across, she made sure she explained who she was and what she was going to be there for and how she was going to support me, so that it was very clear communication on that. And so anytime that a new nurse came in, because I was there for 21 days, they knew me. They go, oh, we know Juanita. We know Juanita's doula. We know who she is. And
right.
I think it changed. I feel like it definitely helped to change my experience to be a positive experience.
That's fantastic, and that's good to hear, because it's I think this is new, and it's new. It's not new, but it's new for some providers, right? Like that's the context where it can be new. I think in integrating doulas more into these larger health systems. So it's good to hear that there's that rapport and receptivity that you found. Another question we have, and Kenda, I think this is a question for you. What are the major barriers within the doula community with other members of the maternity care team and with other legislators and advocates? So if you could, I think it actually might be helpful for our audience to maybe take this from a kind of an advocacy frame. So as you were starting to work on advancing a doula benefit in Virginia, what are some of the barriers you ran into with legislators or with the state? And and how did you overcome them?
Sure. So first of all, when we launched Birth in Color, it was like, what are they doing and why? And this is not needed and all the things so we had to raise awareness to the issue. Then we had to raise awareness to doulas, and half of them didn't know what doulas was. And if they did, they had a horrible experience. So they didn't want doulas. And so it took a lot of like, hey, raising awareness, and talking about the issues, hearing from the community also, like the community actually wants this, so let's talk about it. Bringing different providers to say like, no, I've worked with doulas before and they're amazing, and just having those key allies that could actually speak to their own colleagues was really, really important. And then also when it came to legislation, they had no clue what doulas were. It was just like, why are we even talking about this? Isn't every pregnancy the same? Well, then we had to get like really graphic with them to say like, no, how many kids do you have? And some was like, oh, 3. I said, was every pregnancy the same? And it was like, well, no, the first one she had vaginally, the second one was a C-section. And then I was like, okay, so now you get to see that all births are different. And so sometimes what we think is like minimal and doesn't matter, those are the key things that are actually going to help to overcome those barriers. Because just simply talking like that, just simply saying, okay, let's talk about your wife's births. What did that actually look like for you? And then that made them think about like, oh, wow, okay. So now then we talked about the issue. Okay, now Black women are dying 3 times more than white people. And at that time, 68% of the deaths were preventable. Now it's 82. But at that time it was 68%. So it's like, and 68% of these are preventable. So what does that look like? And then they're like, but why is it? And then we had to bring awareness to racism, things that go undetected, not listening, what the systemic systems that are in place that was never designed for people of color to thrive. Then we had to raise awareness to that issue. So sometimes it's not raising awareness to everything at one time. Sometimes it's actually dissecting it and breaking it down to say like, okay, we're going to focus on this first, and then we're going to go with this, and then we're going to go with that. And then we're just going to stay consistent to where they're actually paying attention and seeing what's actually happening. Because if not, you will be met with resistance. They will say it's not needed. They will say that it's not necessary. And then you have to break it back down to them to say like, well, actually, doulas is not a new thing. It was actually here forever because midwifery was here by the granny midwives. And so those midwives sometimes used to be doulas. And then sometimes they used to be things called birth sisters. So when you dissect it down to them to make it simple to talk about the history of doulas and how far back doulas were always a thing, it's just that the name doulas is new to them. And so that can help to overcome a lot of those barriers. And creating a cute, crafty campaign that grabs their attention. Because half of the time they wouldn't open emails from a basic email, but when I put in the subject line Birth in Color, they're like, what is that? And so then they open the email. And I've had providers that tell me that like, oh, I actually opened the email because it said that. I wanted to know what it was.
That's such an important tip, because I think particularly for folks who work on policy and just think about policy, like sometimes you lose track of that human element on like, what does it take to connect to another human being, an individual that you need to connect with to make something happen in your state. And sometimes it's that, clever, creative communications work that you engaged in. So seeing sort of like where we're at on time, I want to give the opportunity for all of our panelists to sort of share one thing out on, if for our audience, if they were to take just like one thing away from your work or the conversation today, what would that be? And if we could, I'd like to start with Consuelo.
Well, I would say one thing would be just to be open to the process of working with community people in a way that is embracing, we hear their voice, and that we really take their suggestions to heart and implement them. And we did that with the doulas, and I think that was our success.
That's great. Juanita?
I would like to say that just being here and being present for this experience is a real true kind of full circle moment. And I'm grateful to be able to be a part of this process, to see the grassroots of how this was built upon, and then to be able to know that I've been a recipient to all of this hard work that has been put into place from this is like mind blowing to me, honestly. So I would say for me in closure, to know that this can be implemented just from what we're talking about right now in other places is an amazing thing. And I hope that everybody who's present today can take from this that it is possible to be able to, when put in the work, to see wonderful things happen from it. And I like to think that I am a great example of that.
That's such a great, encouraging message. Kenda?
Sure. So I'm gonna say it from two different levels. For the advocates and doulas, don't be afraid to second guess what they're actually telling you when it comes to the processes. Because if it's something that you want and that you're truly adamant and focused on, it can call. Give doulas a chance. Like, not all doulas operate the same. We don't want to argue with you. That's not what doulas are for. We're really here to just bridge the gap between you and the client, and we both want the same outcome: healthy mom, healthy baby, and having the partners also included in the birthing process.
Great, thank you. Well, that will conclude our discussion for today. I do see that there were some questions in the chat that we weren't able to get to. We will pull those questions and send around Q&As after after today. But I want to thank everyone again, especially Juanita, who has a 3-month-old little one and still was, wanting to be a part of this discussion today. Thank you, Consuelo, Commonwealth of Virginia. Thank you, Kenda, Birth in Color. Really appreciate your candor and conversation.
Thank you. And
Thank
thank
you.
everyone.
Thank you, guys.